Well, hello, everybody, and welcome to this very important discussion on the COVID-19 vaccine. I'm Melissa Randall, Corporate Communications Manager for Fallon Health, and I'll be moderating today as we talk about the importance and benefits of getting vaccinated. We brought together a distinguished panel of experts to weigh in on the topic. So in no particular order, let me introduce you to our panelists. We have Dr. David Brumley, Vice President of Medical Affairs for Fallon Health. Good morning.
Morning, Melissa.
Ben Barner, Senior Director of Pharmacy for Fallon. Morning.
Morning.
Dr. Maddie Castille, Worcester Commissioner of Health and Human Services. Hello.
Hi, how are you?
And lastly, Steve Kerrigan, President and CEO of the Edward M. Kennedy Community Health Center. Good morning to you as well.
Good morning, Melissa. Thanks for having me.
All right, everybody. Well, thank you so much for being here. We have a lot of ground to cover, so let's dive right in. It has been 1 year since the first announced case of the coronavirus in the United States. And here we are with a vaccine now available. So I'd love to hear your reaction to this level of progress. Dr. Brumley, would you like to start?
Well, it has been a remarkable year, no question. I think we are seeing the light at the end of the tunnel with the vaccines being developed and rolled out. So that's very exciting. So we're looking forward to continuing to get those rolled out, get people immunized, and moving forward and making some progress.
Yeah, Dr. Castille, same question for you.
I think the vaccine is the most important thing that it has happened in our community. That we have a 95% efficacy with this vaccine is incredible. And so hopefully getting everybody to get what we call herd immunity, we will maybe at some point get rid of our masks and be able to say hello to our families. And that's an important piece.
Wouldn't that be so nice? I feel like we've missed that so much. Steve, maybe you can weigh in just a little bit about how of an important tool this is to stopping the pandemic.
Yeah, it's critically important. And at federally qualified community health centers, we serve people regardless of their ability to pay their bill. And so we have typically our patient population is lower income, a lot of immigrant community, folks who are having a struggle understanding the benefits of this vaccine, but who are impacted the most through all the different social determinants of health and the negative effects of living in large housing areas, food insecurity, and frankly, the economic benefits of this vaccine are going to be sizable to our community and our country. So it is hugely important to us to get as many of our patients vaccinated in our community. And we're glad to join with everybody on this panel to do as much as we can to get to the herd immunity that we talked about as soon as possible. But it really is, it's a game changer for health. It's a game changer for the economy and for the world as a whole.
You know, a big part of this is going to get people to be accepting of the vaccine, right? And there's been, maybe some questions about the safety and the development and the approval timeline. Ben, maybe you can weigh in a little bit on that for us.
Yeah, sure. So it's been a whirlwind over the past year to have a vaccine created so quickly. It is exciting, though, that this work started long before when SARS-CoV-1 had come out close to 2 decades ago. The research started then. And so scientists have really been able to learn from that and develop this new product. Over the past year, the FDA has been advised by the Vaccines and Related Biologic Product Advisory Committee. And it's encouraging to have that independent committee with specialists, that are focused in vaccine safety, immunology, fields that ensure that we can be confident in the vaccine. And I know some people are going to be kind of concerned. We only have 2-3 months worth of data for the vaccine being out. But it's encouraging. Historically, a lot of vaccines, most of the side effects or adverse effects that happen with them historically have been within the first 6 weeks. And so I feel confident we have a lot of good data to know that it's going to be safe and effective.
Yeah, you mentioned some of those side effects, fever, chills, headache, to name a few, but I understand that these are actually normal signs that your body is building protection. Dr. Brumley, maybe you can talk about that.
Sure. Yeah, I think that Ben raises some good points. It also, there's the focus on this vaccine has been global, really, and a lot of federal support and financial support getting it put out there. So clearly it's safe, and the FDA does their own independent data review. So that's certainly a positive sign as well. In terms of how the vaccines work, basically what they do is they prime your own body's immune system. So they trigger cells in your own body to fight off the virus. There's some types of immune cells that are general and others that are very specific for very specific vaccines or viruses. So the vaccines will teach those specific cells how to recognize the virus when it enters your body. And so when you get the vaccine, you're getting sort of a priming of the immune system, and that's what typically causes the symptoms of fever, the achiness, the mild symptoms. Some people experience more than others, obviously, but that's how it works. So that's actually a good sign that it's working, even though it might not be that pleasant. It's a good sign that your body is doing what it's supposed to do and recognizing the viral particles when they come back.
Melissa, if I could jump in for just,
sorry, go ahead, Steve.
So I think one of the points Ben made was incredibly important. We try to echo this to our patients and our staff who are nervous. I mean, there are people who are concerned about taking a vaccine, no matter what the vaccine. And the fact that it was developed in a year makes people even more nervous. But Ben's point about COVID-1 and the fact that this has been based on data for 20 years and research that's been going on for 2 decades is really, really important for people to hear. People who have anxiety about vaccines, people who have anxiety about the emergency authorization. It's a really important point that I hope those who are watching hear very well, do their own research to make sure that they're comfortable with the facts. But Ben's point is really well taken, because this is not something that popped up a year ago and we said, oh, well, let's take a plain sheet of paper and get going and try to figure out a vaccine. They went to the people who've been working on this for decades and decades and decades, and that's how we were able to turn it around.
No, thank you. That's a really great point. And Dr. Castille, you talked a little bit about the herd immunity factor. So the more people we can get vaccinated, is there a message here about how if you're not maybe willing to do it for you, maybe do it for others, those you love around you?
Absolutely, absolutely. And I talk about not being selfish and thinking about yourself. A lot of people think that, I either had, I got COVID, but I didn't have any symptoms and I was perfectly fine. So my body is strong. I don't need anything else. I don't need a vaccine. And I think that, you may, first of all, to know that anybody who has COVID has the ability to get what they call long hauler syndrome. So you can have all kinds of effects. And so why I say not to be selfish is that that there's complications that can happen, but for the other thing is you have to protect our community. And so not only are you protecting your friends and your family and anybody close to you, but you're also going to protect me. You're going to protect everybody else in our community. And so if we all got the vaccine and we all got what's called herd immunity, where at least 80% of people are getting vaccinated, we will eradicate the virus. It will have no place to go, and we can take our masks off, and we don't have to socially distance, and we could live a normal life. So I'm looking forward to that. So thank you.
Very good. All right. I think that's a great place to stop. I'd like to offer you guys each final thought. Steve, would you like to start?
I would just say I want to echo the great words that Maddie just said about herd immunity. This is, I like to tell people, get the vaccine so you can give a hug. This is a real opportunity to bring us all back together and, frankly, to reboot our economy. 10 million Americans have lost their job, and the sooner we get to herd immunity, the sooner we can start getting back to normal.
Couldn't agree more. Ben?
Yeah, just to echo, it's a really exciting time. And from a pharmacist standpoint, the new technology that's been put in with these vaccines, with the messenger RNA technology, has really helped us ramp up the production of the vaccine. So we're able to get this out to so many lives so quickly. So I'm really encouraged to see the progress we're going to make this year.
People are waiting. Dr. Brumley?
Yeah, no, I agree with all those comments, certainly. I think it's very exciting to see the vaccines coming out, and it's a very important big step forward. I would also just remind people, though, even though with all that hope and excitement, we still have to be diligent about wearing masks, social distancing, and all those sorts of things, till we do get to that herd immunity, which will take a little while, but we're making great progress toward that.
We're well on our way. And Dr. Castille, finally.
So everybody has said everything that I agree with and I would have liked to have said. I think one of the things that people always ask me about, that they're hesitant about getting the vaccine, is that they're concerned that we're injecting the virus, and will I get the disease if I get if they inject the virus into me, and sort of what Ben had talked about. There is no injection of a virus. There's no live virus like we did with other vaccines in the past. There is no what we call attenuated, which means a virus with maybe less infectivity that's being injected. This is no virus injected into the body, and there's a process with the mRNA how we copy the virus, but no live virus to affect anybody.
Wonderful. Well, you guys have all certainly given us so much to think about, and we really appreciate your thoughts and your expertise on the COVID-19 vaccine. For Ben, Steve, and Drs. Brumley and Castille, I'm Melissa Randall. Thank you all so much for joining us, and have a great day.
Thank you.
Thank you.